Nurse Callie Reeves had walked with a limp for as long as anyone at Ashgrove General could remember. Nobody ever asked why. They just laughed about it instead. Then a gunman walked through the ambulance bay doors, and the same leg they'd mocked for 2 years was the one that got her across that room faster than anyone else could move. Callie started at Ashgrove General 3 years ago, 28 years old at the time, quiet, capable, with a slight hitch in her stride that she never explained and nobody ever respectfully asked about. Instead, they built jokes around it. "Reeves, you want a head start walking to that trauma bay?" Dr. Preston Kane liked to say, smirking at his own wit. Kane was the ER's senior attending, a man whose confidence had long since outpaced his humility. The kind of doctor who treated bedside manner as something reserved for patients, never colleagues. The nurses laughed along, not out of cruelty exactly, but out of the easy comfort of a running joke nobody questioned anymore. Nurse Denise Wallace, the shift supervisor, was subtler but no kinder. She simply never assigned Callie to anything requiring speed. Codes went to faster-looking nurses. Trauma bays went to whoever could get there quick. Callie got charting, medication passes, quiet rooms. "It's not personal," Denise told a new resident once, not lowering her voice enough. "She's good with patients, just slow. Can't exactly sprint a code with that leg." Callie heard it. She always heard everything. She said nothing, the way she'd learned to say nothing about most things concerning that leg. The scar ran from her hip down past her knee, thick and old. The kind that came from something far more violent than the car accident she offered whenever anyone asked. Most people didn't ask twice. Why would they? She was just the slow one, the one who couldn't sprint a code. What nobody noticed was that Callie never actually failed to reach a patient in time. She simply moved differently. Economical, deliberate, never wasting a single unnecessary step. The exact opposite of slow, once you understood what you were actually watching. One Tuesday during the shift handoff, Kane made the joke that would define the following week. "Reeves, you're on meds today," he said. Not quite smirking, but close. "Let's not test that leg on anything urgent." A few nurses chuckled. Callie nodded once and walked toward the medication room, her limp entirely unhurried, entirely unbothered. A rhythm she'd made peace with, long before any of them had met her. Nobody in that hospital knew that the woman they mocked for a limp had earned that scar pulling a wounded soldier 50 yards under direct fire, refusing to let go of him even after the round meant for his chest had torn through her own leg instead. Nobody knew that every step she took now was a quiet, permanent reminder of the night she'd chosen someone else's life over the shape of her own body. They would find out. Just not yet. The call came in at 8:15 that evening. A factory accident, 1 patient, critical, severe blood loss. ETA 4 minutes, the ER erupted into motion. Denise rattled off assignments fast. "Tors, get Bay 2 ready. Kane, your primary. I need runners on standby." "And Reeves?" Torres asked. Denise glanced toward the medroom. "Keep her on meds. We need people who can move on this one." Callie said nothing, simply positioned herself near the supply cart, watching the doors, and then they burst open, and the chaos that followed made a mockery of every assumption in that assignment sheet. The patient's leg was crushed. Arterial bleeding soaking through field dressings, faster than the paramedics could manage it. Blood pressure crashing with every passing second. "He's lost at least a liter. Pressure's 60/40 and dropping," the paramedic shouted. "We can't get the bleeding controlled, tourniquets slipping." Kane moved in, hands fumbling slightly with the replacement tourniquet, his voice climbing with the specific panic of a man more comfortable directing others than doing the work himself. "I need another set of hands now," he snapped, scanning the room. Torres was mid-setup elsewhere. The junior staff hovered, unsure, his eyes landed reluctantly on Callie. "Reeves, get over here." Callie didn't hesitate. She crossed the room fast, faster than anyone expected, her limp barely slowing the economy of her motion, and the moment her hands touched the wound, something in her shifted entirely. "Tourniquet's too low, it's not compressing the artery," she said, already repositioning it with practiced, unshaking hands. "You need it higher." Right above the wound. Full rotation. Hold here. That's not the standard placement. It's the correct placement for this injury, Callie said, cinching it down hard, watching the bleeding slow almost immediately. Standard doesn't account for where the artery actually runs on a crush injury like this. Kane, startled by the sudden authority in her voice, said nothing. BP's stabilizing, Torres called from across the room, having glanced over mid-task, stunned. 68, 74, 80. He needs fluids wide open and a surgical consult now, Callie said. This buys time. Someone page vascular. Denise, hearing the commotion, turned just long enough to see Callie's hands moving with a precision that had nothing to do with slow or limited, or can't exactly sprint a code. Where did you learn that placement? Denise asked slowly, unable to stop herself. That's not textbook. That's, she paused, searching for the word she didn't quite want to say yet. That's field trauma. Training. Callie said simply, not looking up, entirely focused on the wound in front of her. But Denise had a brother who'd served overseas, and something about the calm, the exact placement, the total absence of hesitation, nagged at her in a way she couldn't yet name. Then she saw it. As Callie adjusted her stance to reach further across the gurney, her scrub pant leg shifted just enough to reveal the true length and shape of that scar, thick and deliberate in a way no car accident ever left behind. Denise's eyes lingered there a half-second too long. Callie noticed her looking. Something flickered behind her eyes. Not embarrassment. A quiet, familiar warning. Bay's getting crowded, Callie said, straightening. I've got him stable. Go check on the next one. Denise didn't push. Not yet, but something in that room had cracked open, small and unmistakable, the way every buried truth eventually surfaces once the pressure gets high enough. 20 minutes later, the patient's monitor began alarming sharply. He's bleeding out somewhere else, Torres called. Pressure's dropping again. This isn't the leg. Kane moved to push more fluids, voice tight with rising panic. Wide open now, we need to. Wait, Callie said, already at the patient's side, hands moving to his abdomen. Pushing fluids won't fix internal bleeding. Feel here, his abdomen's rigid. He's got a hidden bleed from the crush injury, probably splenic. Fluids alone will just dilute what blood he has left. That's not what the initial assessment showed. The initial assessment was done before internal pressure built up, Callie said, voice level, hands steady. He needs emergency surgery, not more fluid. Page the OR now. Tell them ruptured spleen, tell them to move. Kane hesitated, staring at numbers on the monitor that made no sense for a straightforward leg injury. Doctor, Callie said, quiet but absolute. Every minute you wait costs him blood he doesn't have. Make the call. He made the call. The surgical team arrived within minutes, confirming exactly what Callie had described before they'd even opened him up. The patient survived, and by the time the OR doors closed behind the gurney, the entire ER staff who'd witnessed the last half hour stood in a silence that had nothing to do with the usual post-crisis quiet. How? Kane said slowly, staring at Callie. Did you know all of that? Every single call? I've read bodies like his more times than I'd like to count, Callie said quietly, in places a lot less forgiving than this ER. From the hallway, unnoticed until now, a man on a gurney of his own, brought in earlier for a minor laceration, now sitting upright watching everything unfold, spoke up, voice hoarse but certain. Sergeant Reeves, he said. It's you, isn't it? I heard your voice, and I thought, no, it couldn't be. But it is. Callie went very still. I'm sorry, Kane said. You two know each other? The man let out a short, disbelieving breath. Know her? She's the reason I'm alive. Pulled me 50 yards under fire when I couldn't move my own legs anymore. Took a round meant for my chest doing it. I never got the chance to thank her properly, because she was gone from the unit before I got out of surgery. Been wondering for 2 years what happened to her. Every eye in that ear turned toward Callie. I didn't do anything special, she said quietly. I did what anyone would have done. No, the man said firmly. You did what almost nobody does. That's the difference. Kane's face had drained of color. He was staring at the woman he'd spent 2 years joking about, the woman he'd routed to medication passes and quiet rooms because of a limp he'd never once asked about. You overrode my call tonight, he said, voice hollow. Twice. I saved his life twice, Callie said, no anger in her voice. Only tired clarity. You were about to push fluids into a man bleeding internally. I couldn't let that happen because nobody stopped to ask the right questions first. You should have told someone about your leg, Denise said, though there was no mockery left in her voice now, only something closer to shame. I did tell you, Callie said. Every single day I walked into this building. You just never asked what it actually meant. The hospital board called it a review of unauthorized clinical override. Callie called it what it actually was, an inquiry into whether she'd be punished for saving a life, without waiting for permission, from a man who had spent 2 years deciding her injury made her less capable, not more. She sat across from the hospital's chief medical officer, 3 days later, a hospital attorney beside her checking his watch. You directed clinical decisions above your authorized role tonight, the CMO said, reading from a file. Twice, overriding the attending physician. Regardless of outcome, that raises real liability concerns. The outcome is a man is alive who might not otherwise be, Callie said evenly. That's not the question at hand, Nurse Reeves. With respect, a voice said from the doorway, I think it's exactly the question. Kane stood there, Stilson scrubs, uninvited but present anyway. I was the physician of record, he said, stepping inside. I was wrong twice tonight, and both times she caught what I missed before it cost him his life. I've reviewed the case since. There's no version of that night where my judgment was better than hers. The CMO's eyebrow lifted. That's a serious statement, Doctor. It's an honest one, Kane said. I spent 2 years mocking a scar I never once asked about, deciding it made her less than the rest of us. Tonight she was the only reason that man is still breathing. Denise, asked to attend as witness, spoke next, her voice quieter than usual. I want that on the record too. We built a running joke around her for 2 years instead of ever asking a single real question. That's not a protocol failure. That's on all of us. The attorney cleared his throat. This doesn't resolve the liability question. Then ask a better one, came a voice from the hallway. The patient from earlier, now steadier on his feet, stood in the doorway, having insisted on being present. I served alongside combat medics for 6 years. What she did tonight isn't a violation. It's the exact instinct that scar on her leg was earned teaching her. Act on what you know is true, even when the room around you hesitates. She didn't break your rules tonight. She followed better ones most people in this building never had reason to learn. The room went quiet. The CMO closed the file slowly, her tone shifting from procedural to something closer to respect. I'll take this under full review, she said. Off the record, thank you for what you did tonight. Take your time, Callie said calmly. I'm not going anywhere. The review might have ended there quietly, if not for what happened 1 week later. It began when a man connected to the earlier factory accident, the crushed patient's business partner, convinced the accident had been covered up as negligence rather than reported honestly, arrived at the hospital demanding records, agitated, armed, and increasingly unstable. As staff tried to explain privacy laws, he had no patience left to hear. Security caught the escalation on camera fast. A man pacing the lobby, weapon visible beneath his jacket, voice rising toward the front desk staff, who had no way to de-escalate what was building in front of them. Lockdown, the security chief's voice crackled over the radio. All non-essential staff to shelter positions now. Callie, finishing rounds nearby, heard the alert and moved toward the lobby instead of away from it, her limp steady and unbothered as ever. You need to get clear, Reeves, a tech said, already pulling patients toward a back hallway. He's got a weapon out there. I know, Callie said. That's exactly why I'm not leaving this hallway empty for him to walk through unchallenged. She stepped into the lobby before security could fully engage, hands raised, voice dropping into the same low, steady register that had held a factory patient's fate in her hands an hour earlier. My name is Callie, she said. I need you to hear me before this goes anywhere neither of us wants it to go. They're hiding something, the man snapped, weapon trembling in an unsteady grip. My partner almost died and nobody will tell me the truth. I was there, Callie said. I treated him myself. I can tell you exactly what happened. Every detail right now, without you needing that gun to get it. But you have to put it down first. Because right now the only thing standing between your partner, having you at his bedside tomorrow, and not having you at all, is this next 10 seconds. His hand shook. The weapon lowered an inch. Then another. I just want the truth, he said, voice cracking. Then let's go sit down and I'll give you all of it, Callie said gently. Set it down first. The gun clattered to the floor. Security moved in fast but controlled, following Callie's steady hand signal not to escalate. And the man was taken into custody, without a single shot fired, without a single further injury to anyone in that lobby. The hospital board, informed within the hour, arrived the next morning to a version of Ashgrove General that had changed overnight in ways no policy memo could have engineered. The chief medical officer stood before the full board and read from a report entirely reframed from where it had started a week earlier. Nurse Callie Reeves, she said, combat veteran, wounded in action retrieving a fellow soldier under direct fire, decorated for valor. In the last week alone, she has corrected 2 life-threatening clinical errors and de-escalated an armed confrontation in this hospital's lobby without a single additional injury. She looked up. This board owes Nurse Reeves a formal apology for 2 years of documented mockery directed at a decorated veteran, and announces immediate changes to how this hospital treats visible injuries among its own staff, with respect, not ridicule. Kane requested a private meeting with Callie that same week, not to defend himself, but simply to apologize plainly. I made a joke out of something I never once had the decency to ask about, he said. That's entirely on me. I'd like to learn how to actually see people properly, if you'll let me. I will, Callie said. But it starts with asking before assuming. Denise requested to be paired with Callie's shifts permanently, calling it quietly the most honest lesson she'd had in years of nursing, and Callie Reeves, once mocked for a limp nobody bothered to understand, was offered the hospital's new trauma response lead position, a role she accepted only once it came without ceremony, exactly the way she preferred to be recognized. 2 months later, Ashgrove General looked much the same on the surface. But something underneath had shifted permanently. New hires were trained differently now. Nobody joked about a colleague's injury without first asking its story. Nobody assumed a slower step meant a slower mind. Kane ran his new training sessions with a humility that had cost him nearly everything to learn. Denise trained incoming nurses with a phrase she now repeated constantly. Ask first, assume never. And Callie still walked with the same limp, the same unhurried rhythm. She always would. It had never been the weakness they'd assumed it was. Because everyone in that building finally understood what her scar had been trying to tell them all along. A limp is not a limitation. Sometimes it's simply the shape courage left behind. The body remembers what the mouth never explains. Muckery is easy. Curiosity is harder and kinder and almost always more honest. And the slowest step in the room sometimes belongs to the person who has already outrun everyone else's worst day and lived to walk back from it anyway. The end. This story is fictional and created for entertainment purposes only.